So my name's Esther, I'm a speech language therapist. I trained in England and came to New Zealand 6 years ago. I work mainly with children preschool age and also some children with complex needs in schools. Communication is something we do every day, whether we do it non-verbally or verbally. We communicate with lots of different people at all different times. It's something that we do naturally, whether it's verbal or non-verbal, and it's just a very social way of being with people and enjoying each other's company. It also means that when you can communicate, you can tell people either what you want, what you don't want, which is really important, and also give your opinion on things and comment about what you like or don't like.
Hi, my name is Dina and I'm the Clinical Nurse Specialist Lead for Intellectual Disabilities at Palmerston North Hospital. I've been an intellectual disability nurse for 30 years and my whole passion inside and outside of work is enhancing the quality of care for people with an intellectual disability, and if they can't communicate their need, then they can't self-empower themselves. 40% of all people with an intellectual disability have communication needs, and we know that people with an intellectual disability also have a higher health need than people with the general population. So it's really important that we assist them to communicate more effectively, because quite often when people can't communicate their needs effectively, then they're seen by the health profession as challenging behaviour, so therefore then there's barriers put up and their health needs aren't met. So if we can assist people of any age to communicate more effectively, be it through visual communication, sign language, picture boards, whatever, then we enhance them to communicate more effectively and get their health needs met.
Hi, my name's Ali Atwell, and I run a non-profit organisation called Voice Through Your Hands, and we're about promoting the importance of visual communication and New Zealand Sign Language for the hearing community that have difficulty with speech. Able to communicate, it really makes you have confidence about who you are and be able to interact with people. Even if they can't always understand what you're saying, you know that you're getting your message across, and that's the best thing. It just, the whole world becomes open to you, and you have just got so much more passion and much more life in you when you know that you can express your feelings and your concerns and things that are really exciting to you.
From a health perspective, if you have an adult lying in a bed and they're 6'4" and 200 kgs, but they have a moderate to severe intellectual disability, then developmentally you're looking at someone who is going through the stages of 5 to 6 year old. But from an outside, they're looking at someone who's 46, 47. But if communication is difficult for them, then their only way of expressing pain is to scream and shout and wave their arms and legs. And that would be perceived by staff as aggression or violence or threatening. But if you can teach them a few signs of pain, hunger, thirst, then suddenly they're not seen as the aggressive patient in room C4, but they're seen as the person who's frightened, hungry or in pain.
I know with my daughter, Taryn, when she was little, she had no communication at all. She wasn't able to talk. And I know that when she was around, she didn't have access to communication. She was very quiet and very reserved, sat back and watched a lot and didn't participate in a lot of what was going on at school. And as soon as we opened her world to using New Zealand Sign Language, and then actually got everybody else around her using New Zealand Sign Language as well, this little girl just blossomed, and she now has no worries about communicating with anybody, and she doesn't have a communication difficulty. Other people might have difficulty understanding her, but she has no communication difficulty anymore. And that's what we want for all children, to have that confidence to be able to communicate throughout in the world.
So for some children, we'll try different approaches to see which one works best for them. And it may be that we use a combination of those things in different situations. So if children are very visual and look at photographs and enjoy books and things like that, then we'd look at using some pictures to help them understand about different things. They may then use some sign alongside the pictures, so we can use a combination of ones. And also in different environments. If your child is in an environment where sign isn't being used, then for them to be able to use pictures in a different environment is going to be really beneficial for them, because there's nothing more frustrating than trying to talk to somebody and them not understanding you. So children can use whichever forms help them in whichever situations.
Some of the fears that people have around using New Zealand Sign Language. For example, one of the biggest ones that people are really worried about, that if you're going to use New Zealand Sign Language, then our children aren't going to be able to communicate. And or not use their words because it's going to be so much easier to sign, so then they're not going to talk. Actually, the reverse is true. Actually encourages the speech, because what it does is it encourages the communication. And when somebody is communicating with you, you communicate more, so you're talking more to them, and that whole signing, and you've got an understanding of what they're trying to say and helping them to articulate the words. So then by the end of it, they are actually being able to talk and say the same things and read a book, like, so other people can understand.
If a person who for years hasn't been able to communicate, and then they can even only enhance themselves by learning 4 or 5 skills, but can suddenly say yes or no, or can learn the sign for a drink, and suddenly can learn those basic skills of nutrition or hydration, and can ask for a drink and someone to accept that, the joy in their faces when that gets recognised is like us getting our first wage packet or getting our first car.
With her confidence in communication, Taryn has just been able to move forward through her education, because without a way of communicating, then you don't feel like you belong. You're not going to be ready to sit down and learn how to read a book, because you're too busy sitting there going, oh gosh, I really need to go to the toilet, but I don't know how to tell you. So with Taryn, because she's got that beautiful communication and she knows that she can get her needs met and get that message across, even if it's only to a few people, she knows she can get her message across, so she can sit down and read that book. Her first school that she attended, she was there for 2 years, unfortunately didn't embrace the signing, and I was still learning as a mother how important signing was for her, and we left that school to go to her current school. And she left with a report that she couldn't read, couldn't write, couldn't do anything. After 6 weeks being at the new school, we had our first IEP, which is an individual education plan, and they told me that Taryn was up to level 3 reading books, that she could write her own name, and she was doing everything she was supposed to be doing. Now, the new school was fantastic, but they didn't teach her that in 6 weeks. But what they did do is they embraced the signing. So that meant that when Taryn sat down to her book, she couldn't say the words, but she could tell them that she knew the words by signing them. And that's what's really important. If you've got a child that can't communicate and can't tick your boxes like you normally do, then you do think that they don't know anything. You only have to look at those people with cerebral palsy that can't sign, can't talk, and then they get given this wonderful computer that they can activate with their eyes, and how much the world opens up for them, because they're able to communicate to you how they're really feeling and what it's like for them. And it's just the same with using sign. But not one size doesn't fit all. Like, signing wouldn't have helped those that can't move their hands. So it's about visual communication and looking at communication as a whole and all the different options out there. For Taryn, New Zealand Sign Language was the best thing we could ever have done for her. But another child, it may not work. But always think of it as an option.
If you have an effective communication system that you can communicate with many people, then it means you can go out and you can, you can say what you want to try and achieve. Again, sometimes we have goals that we make for children, and actually they're probably not the goals the children themselves want to work towards. Whereas if they've got a way of communicating what their goals are, then they're going to be able to tell us those things. And also, being able to communicate in different environments, make your own friends, be able to go out and order things from them or buy things from the dairy. All of those things are things that children generally want to do and are motivated to do. So what we're looking at is a way of helping them to achieve those things.